So in this respect, IGF-1 is actually pretty essential for healing. So just day-to-day healing. It's important for also building your muscle, especially if you're doing a lot of strength training and things like that. We want more IGF-1, or we want an adequate amount of IGF-1 in order to encourage more muscles to be built. But IGF-1 can also stimulate the growth of unwanted cells or damaged cells or precancer or cancerous cells. And we want to make sure that we're not having too high of an IGF-1 level in the blood to encourage excessive growth of a lot of these precancer cancerous cells. Basically, IGF-1 can act like a fuel source, where more IGF-1 can mean more growth signals for these cancer cells. So there's a bit of like a Goldilocks effect here. We want just enough to encourage some healthy processes to go on in the body, but we don't want too much that's going to encourage a lot of pro-cancer growth going on in the body. All right, so today we are going to be diving into a lab marker that I find often flies under the radar. We are specifically going to be talking about IGF-1, insulin-like growth factor 1, which has a role to play in cancer growth and recurrence prevention. And you might already have gathered this by now, but I am a huge nerd when it comes to numbers and data points and understanding more about what is going on for the person in front of me, alongside the general population evidence. But I really want to get into the nitty-gritty of people in front of us and what is going on within their body. And I find that blood work is one of these things that we really overlook in terms of health and as well as cancer prevention, because we can't just ignore all the different factors on a CBC, for example, when we can look at all the different types of white blood cells and look at the ratios, and that gives us more information as to the strength. Often, whenever someone looks at a CBC panel, like a white blood cell count, they're just looking at the total white blood cell counts, and they're saying, is that high? Is it low? But we can also look a little bit further, and it's pretty much always included when we see the level of all the different types of white blood cells that are there, and just looking at those can give us even more information. Also, blood work just helps us to get a little bit more, it allows us to get at things faster. So we can either rule things in or rule things out if we do a more full panel. We can look at everything from your vitamins, minerals, things like that, and quickly see, are you tired because your iron's low? Is it B12? Or is there something else that might be a little bit harder to identify going on? So it's just a quick rule in, rule out. Our numbers can tell us that very easily on blood work. It gives us a little bit more information on like what's going on internally. Anyway, I won't go too much into that. Like, I'm a huge nerd when it comes to blood work. All of our coaches are huge nerds now that we've taught them in all of our processes and how to interpret and analyze blood work. We all love numbers and data points, and we can't get enough of it. And the other part of it is that it's often kind of cheap to get these done. I know in the big scheme of things, these costs can add up in terms of the total healthcare burden. But from an individualized level, like to get a vitamin D done is like $20, $25 sometimes to kind of get that done. Whereas we know some other functional tests can be in the hundreds of dollars. So just getting some good comprehensive blood work can be very helpful. And in particular, looking at insulin-like growth factor 1, which again is often overlooked even in functional medicine, gave us a little bit of insight into maybe some potential growth factors when it comes to encouraging cancer to grow. So basically, what is insulin growth factor 1? It is kind of exactly what it sounds like. It is a growth promoting hormone that acts a lot like insulin. And it's growth promoting in the way that it can be both good and bad, mostly bad if it comes to cancer, but good in other ways. And I'll go into that in just a minute. But I just want to let you know that this episode is going to be helpful for you if you're wondering what or why blood sugar balance is important when it comes to cancer prevention, recurrence prevention. If you've never had your IGF-1, or maybe you've never even heard of it done, you've never had it tested before, and you're wondering, like, is this something that you should really look into for yourself? And you want to know kind of what is it? How does it pertain to you? And if you want to look at coming at a cancer recurrence prevention plan from a place of evidence and numbers, as opposed to just kind of guesswork and throwing spaghetti at the wall, this is one part that you can add to your plan in order to give you that data point to say, like, yes, I need to focus here. I can definitely see this as a problem or not a problem in my body, and let's go at this and see what we can do to fix it. So let's go into this even more. Let's start with what is IGF-1 in a little bit more comprehensive points here. So IGF-1, it is a hormone produced by the liver. It is stimulated by another type of growth hormone, just called growth hormone. And basically IGF-1, it helps cells to grow, to divide and make new healthy cells sometimes, and also to repair. So if there's any just low-level damage that are going on within cells, which happens to us every day, the IGF-1 will go and help to repair those cells so that they become nice and healthy and full functioning again. So in this respect, IGF-1 is actually pretty essential for healing. So just day-to-day healing. It's important for also building your muscle, especially if you're doing a lot of strength training and things like that. We want more IGF-1 or we want an adequate amount of IGF-1 in order to encourage more muscles to be built. And also it's good in terms of development. So everything from whenever you're just first being developed in the womb to potentially less encouraging your liver cells and is a part of brain function and things like that. So IGF-1 has a lot of positive roles to play in the overall health of your body. But IGF-1 can also stimulate the growth of unwanted cells or damaged cells or precancer or cancerous cells. And we want to make sure that we're not having too high of an IGF-1 level in the blood to encourage excessive growth of a lot of these precancer cancerous cells. Basically, IGF-1 can act like a fuel source where more IGF-1 can mean more growth signals for these cancer cells. So there's a bit of like a Goldilocks effect here. We want just enough to encourage some healthy processes to go on the body, but we don't want too much that's going to encourage a lot of pro-cancer, cancer growth going on in the body. It's complicated. IGF-1, this relationship with the body is complicated. So why does it matter for cancer? You might have already put that together a little bit, but cancer is at its core uncontrolled cell growth. It is when our normal cells have got multiple hits to them, which have turned them kind of mutinous. There's a lot of mutations in there, and they have gone rogue. And then the cells are unable to be repaired. They're evading the immune system. And then if we're going to throw IGF-1 into it, it's like gasoline on the fire, where it's going to encourage these cells to grow and grow and grow. So high levels of IGF-1 in human research have been shown to be associated with increased risks for several types of cancer, in particular breast, prostate, colorectal cancers, as well as a couple others as well, but these are like the main ones that have been researched. The other side, so not only can IGF-1 encourage the uncontrolled cell growth of these cancer cells, it can also prevent apoptosis, which is the definition of it is programmed cell death, which means that it's going to allow some damaged or abnormal cells to survive and multiply when our natural body's mechanisms, our protective mechanism, should have been that cell should have died off and been removed from the body and then replaced with another healthy cell. So instead of this damaged, I like to call them mutinous, they have mutations, but they're also like, they're going against the grain, they're being bad. These cells that are abnormal, they are being prevented from dying. And a lot of that can be due to high IGF-1 levels. Like, it's only one factor. There's a lot of different factors going on, but it is an important factor that potentially we can even make a difference with when it comes to nutrition lifestyle choices, which we'll get into in just a few minutes here. Before we get into like how do we manage IGF-1, let's figure out first if it is even something that you need to manage. And it's so simple just to do a blood test that you can literally measure your IGF-1 levels. And we don't really want to look at IGF-1 necessarily in isolation. We do want to consider a bunch of other markers alongside it. But if we could only ever get an IGF-1 and we couldn't get the other markers that I'll mention in a sec here, it would still be a helpful number to have. But I don't like looking at things in isolation. We have to look at each of these data points and what they mean to one another and what they mean to your big picture and what do they mean to even a bigger picture outside of you with regards to the general population research. So there's a lot of factors in place here whenever we determine is something truly important or is it less important. But from a base level, we first look at your IGF-1. Then we're going to look at other markers that are on the blood work that are going to kind of feed into IGF-1 too, which would be something like your fasting insulin, your fasting glucose. We can also use your fasting insulin, fasting glucose to calculate a calculation called HOMA-IR, which tests for insulin resistance and can kind of give you an idea of, are you completely not insulin resistant? Are you kind of like pre-insulin resistant, or are you flat out in insulin resistance? So that gives us even more information than just looking at your insulin or glucose in isolation, even more than looking at just your HbA1c. HbA1c being a reflection of your blood sugar regulation over the past 3 months, where fasting glucose is more like what's going on within the last 12 to potentially 48 hours with your blood sugar regulation. So if we look at your IGF-1, we also want to get your fasting insulin, your fasting glucose. We can calculate your HOMA-IR from the fasting insulin, fasting glucose, and also look at your HbA1c. These are kind of like your personal markers here that give us an idea of what's going on in your body currently. Then we want to look outside of that to what is your typical dietary habits, your exercise, like what is your overall metabolic health? Because a lot of this is feeding into your metabolic health. And then overall, we want to look at the big general research of like what is the role of IGF-1 in cancer. And then with all of that information, we determine like, yes, your IGF-1 being high, even despite your insulin and glucose being normal or low or whatever it might be, is something that we want to tackle. I hope that kind of gives you a little bit of an idea here, but basically, I just want to point out that just having a high IGF-1 is not cause for panic. There are other things that your body is really good at compensating with when it comes to other markers, other parts of your plan, other parts of research, things like that that can pertain to cancer. So I don't want anyone to get super overwhelmed if they were to get their IGF-1 done and it's high and they're like, oh my gosh, this is it. This is what's fueling my cancer. The cancer, I just really got to get on this. Like, it's okay. Take a deep breath. We can move through this and check other factors as well. We definitely want to work on it, but I don't want anyone to go into full panic mode for sure. So just a simple test. We can do IGF-1. We can do those other blood work parameters too when it comes to blood sugar regulation and some potential growth factors. There's a bunch more. I won't get into them too much today, but that's kind of like the core parts of the blood sugar insulin balance. And why are we not typically testing this from an oncologist standpoint? Well, honestly, it's not conventionally recommended. It's not really seen to test IGF-1 outside of growth disorders because my true feelings are that your medical team is so focused on making sure that you don't have a disease that looking a little bit further in terms of what can we do for the environment in order to not create a recurrence or to create overall optimal health in order to not get disease again is really like above and beyond their brain power. I could not imagine working as an oncologist and knowing all of those medication doses and treatment pathways based on specifics with regards to everything from the person's gender to their age to their blood work, like liver functions, to their other medications that they might be taking. Like that is a lot for any human to understand. And then to have to go and figure out like what can we do to change their nutrition, their stress levels, their sleep, their inflammatory levels, all of these things, that is a lot of work. So I truly don't believe that it should fall within the realm of conventional medicine. This is truly where functional medicine can pick up the pieces and really focus in on the next stage, which is, of course, the recovery and recurrence prevention aspect. So we are seeing a lot of more emerging research in integrative oncology, showing that it might be a valuable biomarker to assess for like someone's cancer recurrence risk. So if we see people come in with high IGF-1s, then there's a lot that we can do from a nutrition lifestyle perspective as an integrative practitioner to help to create this environment where cancer doesn't want to come back over time. So again, I truly don't feel like it should fall within the realm of conventional medicine. I do feel like it is more something that us functional doctors have more brain space to learn all of this and keep on top of the evidence and dig a little bit deeper with the person in front of us, more time, things like that. But not only can you test IGF-1 on blood work, there's also different types of IGF-1. I have to say it's pretty rare that we see the what's called isoforms of IGF-1 get done on people's blood work. Mostly it's used in research, but we have had a couple clients come in, maybe just a handful, where they have their IGF-1, but then they also have it broken down in the different isoforms, which is pretty cool. So I will run through them, but I don't expect, we never even recommend or ask that our clients go and get the isoforms done of the IGF-1. It's mostly just that we're looking at the total IGF-1, but I'm going to go through it because I think it was pretty cool. There's certain parts of it, so certain forms, isoforms that can pertain to different parts of your health and your body that we'll run through right now. So there's this thing called IGF-1EA, which is the most common, the one that's in your blood in the most amount, the highest amount. And IGF-1EA is involved in muscle repair and general growth. So I'll tell you a little story of someone I knew who she was very much into CrossFit and she would exercise every day. And she had gone through a cancer. And I'm not going to go through too many details, but we asked her to get her IGF-1 done, and it was always high. And we figured because, we'll go through in just a minute here. We did know that your IGF-1 can be raised because of exercise and excessive muscle turnover and things like that. Because one, if you're going through a lot of exercise, you're damaging your muscle tissues, and we got to build that back up. And as I mentioned earlier, IGF-1 is one of those things that goes in and helps to build muscle. So we anticipated her IGF-1 actually being high. I actually said to the coach who was her coach, um, that don't be worried about her IGF-1 being high. Let's just see where it's at, and then we'll go from there. But it was like super high, and we didn't love it. Um, we figured, and we couldn't get the isoforms done for her, but we did figure it was because of the exercise. So if this is you, if you are someone who's a very avid exerciser, and you're wondering if potentially maybe you've gotten it done already, you had your IGF-1 measured, and you're like, perhaps it's because I've been exercising so much. We did have to recommend that she stopped exercise for about 3 days to get her IGF-1 redone again. And it did go down. It didn't go down into the normal ranges that we loved. It did go down. And then we just had a conversation around the balance of what you can manage outside of exercise, because she loved her exercise and we didn't necessarily want to take it away from her. We did have a conversation around the roles of IGF-1 and the growth factor impact of it, how most likely it's high because of the exercise she was doing. Potentially that she might want to look at the total exercise that she is doing and what would be her thoughts around reducing that or trying different forms of exercise in order to get her IGF-1 down, which is super rare that we have to ask someone to kind of reduce their exercise. It's usually about us encouraging people to do more exercise, but everyone's very unique. So we had a conversation around it, and I think she did decide that her exercise routine was a little bit hardcore, and she was no longer doing competitions and things like that. So it was more of just a habit for her. And so we just followed up with her numbers over time. But anyway, I went a little bit off course there, but I just think it's nice to hear some stories of other people and some approaches that we can take for those situations. But so that's IGF-1 EA, which is involved in muscle repair and general growth. There's also IGF-1 EC. It's also called MGF, or mechano growth factor. And this one in particular is something that has been shown in research. Potentially, if it's higher, then it might be something that's going to be promoting cancer cell survival and proliferation. So it might be encouraging the cancer cells not to die, and it might be encouraging them to grow more. So that's the IGF-1 EC, or MGF, or mechano growth factor isoform. And then we've got IGF-1 EB, which is still being researched. It may influence immune signaling and regeneration, but again, it's still kind of being researched there. We're trying to figure out what is its role exactly. And honestly, we've only seen the isoforms in a couple of clients. Um, Generally, looking at IGF-1 is good. Potentially, if I had the opportunity in that person who is exercising excessively, I would have loved to see the isoforms, but it just wasn't possible for us to get ordered. So her IGF-1 being high, we could potentially assume that it was the IGF-1 EA, the muscle growth one. Ideally, we would have wanted to see it was IGF-1 EC impacted too, and it might have been even a little bit high just because they're very much related to one another, and one being high might bounce off and increase another one. But in general, we just wanted to get her IGF-1 lower over time, and same for you guys listening too, is we want to see where are your levels at, just your IGF-1 level in general, and try to reduce that over time. So yeah, most standard labs don't necessarily go into the isoforms of the IGF-1, but we are fine with just looking at someone's IGF-1 in general. And it's just in the research where they're starting to break that down a little bit more. So you might read some papers where they're looking at the different forms for many different reasons is why they're looking at that. So what does high or low, because we've seen some low IGF-1 levels as well. So what do the high or low levels mean? In high IGF-1 levels, what it could often mean is that someone might have an increased risk of recurrence. So this is kind of like in our mind, this is our job, is we want to look at what can we do to reduce someone's risk of recurrence. So we're going to look at their IGF-1 and see, let's get that lowered, basically. But really, IGF-1 can be linked to a couple different things, and the reason it might be high, which is increasing recurrence risk, might be due to other factors, and we can look at those other factors and see what are the root contributors. And some of the root contributors might be that you might be insulin resistant. So we need to look at what can we do to make your insulin resistance go away, or make your body less resistant to insulin. I'm looking at your blood sugar regulation, and there's a lot of different things we can do for that, from blood sugar balanced meals to better muscle building and exercise, which seems a little counterintuitive, but trust me, more exercise is going to potentially lower your IGF-1 in most cases. It's only when someone's like excessively working out that it might increase their IGF-1. That Goldilocks effect too, right? We don't want too much or too little. We can also see with blood sugar regulation, like people who exercise enough, blood sugar balanced meals, just looking at their glucose, their insulin markers, HbA1c, is there anything we can do to make sure that someone's body is processing carbohydrates, or do we need to lower the carbohydrate levels, certain therapeutic diets at certain points, like a healthy keto diet for a short term to see if that can impact their insulin as well, and then therefore the insulin like growth factor. But basically, high IGF-1 is often linked to insulin resistance. And we really want to look at it because it is associated in research with faster tumor progression in some cancers. And I will put some studies into the show notes there where they're actually looking at humans and they're measuring their IGF-1 levels and seeing that people with higher IGF-1 compared to people with normal IGF-1 tend to have a higher growth of their tumor, basically. So I'll put some links into the show notes there for you for those papers. But high IGF-1, we want to tackle it. It might be encouraging more cancer growth, and we want to look at tackling it from different perspectives, one of them being looking at insulin resistance and your blood sugar regulation. And I'll give you some more specific ideas on how to bring the IGF-1 down in just a minute. So like I said, we sometimes do get low IGF-1, which could indicate potentially undernutrition, like you're not eating enough foods in order to encourage cell healing and the release of IGF-1. So we want to make sure, because we do have some clients who come to us and they're so afraid of all the foods that they're really limited in what they eat. They're skipping meals a lot of times because it's just so frustrating and scary for them to put certain foods in their mouth that they just are deciding not to eat because that is less anxiety provoking. And I totally get the reasoning behind that because of all the, misinformation and fear-based information being thrown in your face when it comes to food and cancer specifically. But also we want to make sure that you're eating enough to fuel your body, because if we see low IGF-1, it could be that you are just undernourished, basically. Low IGF-1 can also be an indication of aging. It does go lower as we get older because we have less repair and regeneration and things like that to do. And then honestly, like some people are just genetically predisposed to having a little bit a lower IGF-1. Like it's just somewhere in their genetics where it's just normal and natural for them to have low IGF-1. And we have had clients who we just kind of had to come to the conclusion where their IGF-1 is most likely low because of some genetic predisposition that we don't really know about, because they weren't very old and they were eating very well. So it was most likely just something that their body was built to have low IGF-1, which maybe that's even protective for a cancer response. I don't know. That is more kind of my personal opinion, that if someone doesn't tend to produce a lot of IGF-1, then potentially we're not fueling a lot of cancer growth. But who knows? We just don't have that information just yet. But overall, we want to look for a balance. So we want to make sure that's not excessively high for sure. But if we can do anything to improve it being low, if it's due to being undernourished, then that's going to be beneficial for your overall body and the health of your body as well. So we want to get the IGF-1 into nice, normal ranges. And what are those ranges? So your optimal ranges for IGF-1, it does vary based on kind of like whatever lab you're getting your levels done from, and also your age. But in general, whenever we're analyzing someone's blood work, we are looking at women who are post-treatment. We're aiming for like a low normal around 100 to 150 nanograms per mil of their IGF-1 levels. Too low, we're thinking like under 80. We want to see, is there malnutrition? Could it just be due to the age? Because we do work with some women who are in their 70s and 80s and maybe even a little bit above that, although most of our clients are probably 40, 50, 60. But if it's too high, we're looking at like 200 and above, really. That might suggest that you might have an elevated risk factor for encouraging cancer cells to grow. Again, there's so many other factors in place here that we don't want to just look at it in isolation, but we definitely want to make sure if your IGF-1 is high, then we're going to get the insulin, the glucose, the HbA1c, even cholesterol markers, all these kind of other markers tested when it comes, and inflammatory markers tested in order to see, like, is this an actual problem for you? And of course, we're going to tackle it even if everything else looks normal. We're going to start looking at your IGF-1 and some things that we can do in order to bring that down. So speaking of what are those things that we can do to bring the IGF-1 levels down, we want to look at one, testing your insulin. And then if it's high, then we're going to look at lowering the insulin, which is a big factor. There's many different approaches to this. One of them being just looking at your blood sugar and increasing exercise, and certain supplements like berberine, for example, might help with your blood sugar and insulin levels. We look at managing weight. We want to look at the overall fiber intake, the foods you're eating, antioxidant support. All these different things are all going to play a factor in lowering the insulin, which will therefore lower the IGF-1. Another thing that can increase your IGF-1 is your protein intake. So especially like excessive animal protein intake. If you are in poor metabolic health in particular, meaning that like you might be a little bit overweight, you might have high cholesterol issues, high inflammatory markers, maybe you're struggling with fatty liver disease and You can have fatty liver disease and still be healthy weight and everything like that as well. So fatty liver disease can be a little bit of a beast of its own, but having fatty liver disease or poor metabolic health in general, and then excessively eating a lot of animal protein might encourage your IGF-1 levels to go up high. So how do we manage that? We might look at making sure that you're still getting your normal adequate amounts of protein to fuel your body, but looking at other sources of that protein. Can we go maybe even towards more fish or like legumes, your chickpeas, your lentils, your vegetarian sources of protein. And we might even consider a kind of therapeutic short-term diet where we might go specifically plant-based for a couple of weeks and see does that drastically bring down your IGF-1 levels. Never would I feel the need to encourage someone to 100% commit to like any specific diet for life. We kind of want to trial some things out, like a diet out on a therapeutic level sometimes, which might mean we do a, a healthy keto diet for a short term in order to see, can we boost someone's metabolism, insulin levels, IGF-1, things like that. And then after we get our blood markers to where we want them to be, we can then transition them into more of a long-term sustainable diet plan that works for them, that opens up their horizons on what they can eat and enjoy and things like that. So I don't feel like we've ever had to keep anyone specifically on a keto diet or a plant-based diet if that wasn't their chosen preference. We typically will put them on it for a short term as what we call a therapeutic diet in order to meet a certain goal for what we want to see when it comes to their blood levels changing or symptoms changing, whatever that might be. So what else can influence and help to bring down your high IGF-1 would be your caloric intake and even something like fasting. So if we can get someone into healthy caloric levels for what their body needs in order to thrive, if we can get them into a fasting window, meaning that they're not eating for a certain time, typically overnight, or they're eating within a certain time throughout the day, then that can help to reduce IGF-1, again, all shown to be beneficial in human studies. A lot of these research studies are done in like people with diabetes or high cholesterol, things like that. But we know that if people do these like a fasting overnight, then they can see an improvement in their IGF-1 levels, which can we interpret that to be a benefit in a cancer prevention aspect. So if their IGF-1 is high, if we can get that down, that is going to help to reduce the risk of cancer growth and things like that as well, even though the studies are done in like diabetes or high cholesterol. Another thing that is helpful is for bringing down IGF-1 is exercise. So I know I told that story of someone who exercised excessively. So too much exercise can bring the IGF-1 up, but too little exercise can also bring it up. So we can get a little bit of resistance training, muscle building to an adequate amount. And it doesn't have to be super fancy. You don't have to be like, well, how much is that? You'll know that you're not overdoing it, that you're not kind of in bodybuilding competitions and things like that. Like that might be a little bit too excessive, depending on you, depending on your person, depending on the goals. But we just want to get people exercising according to like the normal recommended um, daily or weekly amounts for reducing cancer risk. And that's where we're going to see healthy IGF-1 levels as well. So usually it's like 2 to 3 times a week for about 60 minutes each time, where we're seeing some people do some muscle building activity, resistance training, a little bit of cardio, things like that. And then just general walking outside of that or anything from like a lower activity like yoga. But we want a nice balance of resistance training, muscle building, weightlifting, things like that. And then also some of the other stuff like movement to get the blood flowing, like yoga and walking. A little bit of cardio too, if you're doing a little bit more, like more lunges and things that get your heart rate going whenever you're even doing some of your weight training as well. It's a nice mix. It's not just one or the other. And honestly, just start where you can when it comes to your exercise. I won't get too much into that, but there's so much I could talk about when it comes to exercise for sure. So yeah, so exercise, resistance training may improve IGF-1 levels if they're too high. And then the other thing is growth hormones. So I mentioned earlier that IGF-1 is often increased due to another hormone called growth hormone. Honestly, the reason or the way that you lower growth hormone is you just get older. The best way we can do is just to get older because aging just reduces growth hormone overall. So I wouldn't say that this is a controllable factor when it comes to lowering your IGF-1. I just want to make you aware of it that as people get older, their growth hormone gets produced less because there's less growing to do. And then that is going to reflect back on lowering their IGF-1 as well. But again, I don't recommend people just try to get older faster. It's just something I wanted you guys to know. It's not a controllable factor. And then genetics can sometimes just make people more predisposed to having lower IGF-1 factor. So if you are getting your IGF-1 measured and it is low and you're like, well, I'm not malnourished, I'm eating a lot and I'm not really that old, then it could just be a genetic kind of reason as to why your IGF-1 is low. And I just wouldn't really worry about it too much. So basically, what can you do to balance it? Just kind of recap is we can eat in a way that balances blood sugar. You have your protein, your healthy fat, your fiber at each meal. You overall reduce your carbohydrate consumption. Um, a, a general, like a very general benchmark would be to make sure that your carbohydrates, your consumption of carbohydrates is like 20% or less of your total caloric intake, which some dietitians and nutrition people think that's actually quite low, but that's not including like necessarily your fibers and things like that. So we're looking at the 20% of your total calories comes from carbohydrates. It is a little bit low and it's a little bit of a stretch for some people, but it's just like a benchmark goal when it comes to helping with insulin resistance and metabolic health. The other thing is we want to make sure that we're reducing excessive animal protein intake, maybe focusing more on plant-based proteins, fish. I know fish is technically kind of like an animal, but it's like a nicer source of protein that's a little bit easier on your body in terms of like the omegas and the healthy fats that are in the fish. It's a little bit just better for your metabolic health. The other thing is there's a couple papers just showing that whey protein isolate or whey protein powders may potentially increase IGF-1, but this is in a diabetic population. Again, it might not be totally applicable to you. So we do overall encourage people to look at other types of protein powders, especially if their IGF-1 is high. We look for ones that are not whey protein and look at other forms of the protein. But I wouldn't worry about this unless you actually test your IGF-1, see that it's high, and then maybe we would look at switching you out from a whey protein powder. In general, I won't go too much into protein powders. In fact, maybe it's a good topic for a different episode. I wouldn't necessarily. We often get people to stay away from whey protein powders anyway, just mostly because I feel like we should be looking at more plant-based proteins. Of course, we want to avoid soy protein isolates because it's a little bit wishy-washy in terms of what its impact is on hormones and things like that. So we don't often have a lot of our clients on whey protein powders unless like it's the only one that's palatable to them. It's the only one that tastes good. We do tend to encourage and we have certain suggestions when it comes to more plant-based protein powders. You can also avoid snacking constantly, giving your body a break from breaking down food and insulin being raised and stuff like that. And that's going to help to reduce growth signaling and IGF-1. Movement, like resistance training, I alluded to, fasting can help reduce it. And then focusing on anti-inflammatory foods, colorful vegetables, omega-3s, even spices like turmeric can potentially help with your inflammatory levels and your growth factor levels and things like that. And honestly, I want you to use the lab to kind of guide decisions and not just come at it from a place of fear and just automatically assume that your IGF-1 is done or is high and you need to kind of work on all of these things. We definitely want to get an idea of where is your IGF-1 on blood work before we start to incorporate many of these changes, because it might not be of importance to you. It might not be something you need to focus on. Maybe there's something else that could use your attention instead. And we don't want to get caught up in what could be, and let's instead focus on what is important for you. So I know how easy it is to feel afraid whenever I talk about a marker that is cancer promoting. But I just want you to also remember that these are tools. These aren't the end all be all. They cannot be used in isolation. And a lot of what I talked about today is stuff that we can actually make a difference with. It's not just like it's high forever. What am I going to do about it? Nothing. There's a lot of things that we can change that have been shown to have drastic impacts on your growth factor levels, your insulin like growth factor 1. And honestly, it doesn't define your future to have high IGF-1. It's just a piece of a bigger puzzle. So let's see where it's at and then go from there. And I also want to remind you that you're not just here to block a recurrence or to kill cancer or to stop cancer. You're here to figure out how can you live fully past cancer and not always have to do something because of cancer. So there's a different approach here that we want to see where are your numbers before we go all haywire and try to do this, that, and the other thing. and to also see lowering IGF-1 is a healthful impact as well, not just to kill cancer, because it can help in many different ways. So if you do want to learn more about interpreting your IGF-1, looking further into different aspects of blood work in order to figure out what is the most important nutrition plan, where should I focus my attention when it comes to my supplements or my exercise or just basically your time, energy, money, blood work can be a very helpful place to start with. It's a very foundational approach to creating a plan to help you to feel better faster and to reduce your risk of cancer coming back. So I absolutely love talking about blood work, and I've put together a whole training on it. Right now, I'm just kind of calling it for short, my blood work bootcamp. And you can join that. I'll put the link to signing up into the show notes. It's coming up very soon, and I can't wait to do it. Like, honestly, it's going to be over a couple of days. We're going to make a big party out of it. We're going to learn a lot about what are the things that you want to test for on your blood work. Why are they important in terms of your general health and cancer recurrence prevention? And also, what can you do in order to make these more optimal as opposed to out of range or just okay ranges. We want to get them all optimal in order to create this environment in your body where cancer doesn't want to be. So if you want to learn more about that, go over to the show notes and I'll have that link there to sign up. But that's all I have for you today. I hope that was helpful. We went through what is IGF-1. We went through what makes it higher, what are the optimal ranges, what can we do to manage it. And if you do want to learn more, then I do have that blood work bootcamp coming up that you can sign up for. All right, that's all I have for today. I hope you have a wonderful week and I'll see you soon. Thank you so much for joining me today on the Flourish After Cancer podcast. If you loved this episode, please be sure to leave a review and subscribe so you never miss an episode. Sending all my best your way, Dr. Megan.